We have one of the worst outbreaks in all of the Western Hemisphere now in Canada. And of course, when you have an outbreak at that scale, especially susceptible groups like pregnant women are going to be impacted.
According to Public Health Ontario, since the outbreak began last October, 39 pregnant people have been infected. Only 2 were immunized and 6 babies were born with the virus. While 5 of those infants recovered, last week a baby born prematurely did not survive.
My condolences go out to the family, and this is the kind of nightmare situation you never want to see.
Toronto doctor Fahad Razak, who once led the province's COVID-19 science advisory table, says the death rate from measles could be 10 times higher in pregnant people and tells me an infection can also cause severe complications for the developing fetus.
We know that the exposure can result in severe brain damage, death, premature birth and lack of development in babies. And then this congenital measles syndrome, which is the baby being exposed just towards the end of the pregnancy and being born and having that active infection.
The MMR shot is not recommended during pregnancy. Instead, pregnant, unvaccinated people exposed to the virus are offered an antibody treatment, but it has to be administered within a short time period.
If you are in that category, please get attention right away. This is the kind of thing that you would go to an emergency room for. Don't set up an appointment and then wait 2 weeks to get that appointment. That's not what this is. It has to be given within days of the exposure to be effective.
The number of measles cases in Ontario has now surpassed 2,000, with infections reported in 19 of 34 public health units. The hotspots continue to be in southwestern Ontario communities with much lower vaccination rates. And with summer just around the corner, more spread is expected as more people are on the move.
And so any reproductive age woman, the recommendation would be, if you're not vaccinated, get vaccinated. You don't have to wait until you're planning for a pregnancy, because we know that many pregnancies are unplanned.
And Ontario's Chief Medical Officer of Health has suggested that unvaccinated pregnant people living in areas with active measles cases should consider isolating. Shauna Hunt, City News.